This is our 12th episode of the Spine Bros podcast.
The Dirty Dozen.
I am Dr. William Sonstein of NSPC Brain and Spine Surgery, and this is...
And I'm Rich Obedian of Island Spine and Sports.
The orthopod. Neurosurgeon, orthopod. There you go. A combination. And we have here today our special guest. We are very, very, very happy to have our
lovely Tara McManus.
Tara is here.
Hello.
Tara's one of our patients.
You know, we had such a good time last podcast with another school teacher, so I thought, let's bring another one.
School teachers are definitely
They're a
people
special
that
breed.
Need to be exemplified and actually touted what they do.
Well, they prepare the future of the world.
I think they're underappreciated sometimes, in my opinion. But they're necessary for us.
Who was your favorite teacher growing up?
My favorite teacher growing up was Mr. Fleeter. He was my social studies teacher in 9th grade.
Really?
Yes, U.S. history.
How about elementary school? Do you remember elementary school?
Elementary school, who did I really like in elementary school?
I remember all my teachers in elementary school. My favorite teacher was Corey Schulman. She was a character.
Mrs. Shaw.
Really, really special lady.
Mrs. Shaw taught me cursive writing, which no longer apparently exists.
No longer exists.
The kids have no idea how to write cursive writing now.
No.
What's that about? Why? It's a lost art.
It's just a lost art because
Like
they're
hieroglyphics of them?
They're so digitized.
They're on the computer all the time.
They just know how to use ChatGPT and AI. That's how they do everything now.
I remember every teacher, too. I remember every one of my elementary school teachers.
Every one of my.
I do. Yeah. And I remember all my phys ed teachers in high school, too.
And that's where you.
And that's what I am.
So tell us about your story. How did you come to become a teacher?
Well,
teacher?
I was an athlete in high school.
What did you play?
I did softball, a year softball. That wasn't my sport. I did the shot put and discus and track. That was good. I broke some records there. I was a basketball player. I was a starting freshman on the varsity team. Yeah.
That's pretty impressive.
Yeah.
That's hard to get that position.
Well, how tall are you?
I'm 5'10".
Yes, that's tall for a
Yeah.
woman.
Believe it or not, I was tall in my group, but I came across some even taller girls out there, on the island. I did.
You grew up in Long Island?
I did.
Where in Long Island?
I grew up in North Valley Stream. I went to Valley Stream North. Class of 99.
Class of 99.
Last class of the century.
God.
Yeah. I know. Tell me about it.
I was 83.
We're going to party like it's 1999.
Yeah.
Yeah. It's scary how
I remember that. Wasn't that Prince?
Prince.
Yeah.
It was. Yeah. It's scary how fast time flies.
Yeah.
As you get older, it seems like the time is going faster.
It is. I don't like it.
The summer went by very fast.
I need time. Stop.
I know.
I only have
that's
2 weeks left.
Especially for a teacher,
true.
that's a bad thing.
Hey, you had a nice summer break.
Not long enough. We're getting gypped. Labor Day is way too early this year.
September 1st
Yeah.
this year.
My kids start September 2nd.
Yeah. The teachers start September 2nd, and the kids come in on the 4th.
Because you're in New York City schools.
Yes.
Yeah, I think some of the public schools in Long Island start even before Labor Day.
Well, listen, they can't really complain when you look at the kids and go to Florida. They have to, but they end early though. They end
earlier. They end
in May or
because the
something
summer's
like
too horrid over there.
I met a girl once, a woman, who she's a teacher in Arizona, and they said they do. I want to say it's 6 weeks on, 2 weeks off, throughout the whole year.
Oh, really?
School.
It was something like that. Yeah. It was like you teach for 6 weeks and then you're off.
But they have no summer break or anything like that.
No.
They probably don't get off for every single Jewish holiday. I mean, now the school schedule
not
has
just
gotten
Jewish
crazy.
holidays. We get
There's
every holiday.
Not just Jewish.
There's
but
all the Muslim holidays. There's
the
Diwali,
Chinese,
the Chinese
yes.
New Year.
I'll take.
Those didn't exist when I was. I mean, they existed, but
yeah, really. I mean, we love the multicultural.
If you want to celebrate it, let's celebrate it.
let's celebrate it. We believe in celebrations.
I love celebrating Diwali. There's always good food being done.
Oh, listen. I will celebrate everyone.
Yes.
And I do.
That's a good thing.
Yeah.
So you went to college in Long Island? Or
I did. I went to Adelphi. I went to Nassau for the first 2 years to do the practical thing of saving money for my parents.
That was very thoughtful.
It was very thoughtful. And it was very smart, if you ask me, because everything I took at Nassau would have been the same classes I took at Adelphi.
100%.
So I just transferred to Adelphi. I got my undergrad and my master's from Adelphi.
And you majored in education?
Yes, phys ed. And I still got a master's in health education.
So to be a phys ed teacher, do you major in education or phys ed? Or it's the same? It's kind of the same thing. It's like a.
You have to major in phys ed.
You have to major
in phys ed. And then you get a license in teaching.
After, okay.
Right.
What is, like, when you major in phys ed, what does that usually consist of, like, class-wise?
Do you know that only 10 credits from being pre-med? as a phys ed teacher.
Yeah, because
you have to know all the sciences. I knew anatomy and physiology, kinesiology, exercise physiology, biology. I had to do all the sciences.
Wow.
Did you have to take organic chemistry too?
No, thank God. I guess that's one of the credits I'm missing to get to the pre-med.
That's one over the top to have to do that.
That was kind of ridiculous to take organic chemistry.
Well,
I mean, really, I think the theory behind taking organic chemistry for medical school is it's such a hard class.
It just
that
weeds
it
out.
It
just sounds hard.
It just weeds out people who aren't
able
so
to
motivated or can't handle it. They can't handle the difficulty of it.
Right.
You know,
Right.
How much organic do you actually use on a daily basis? I would say minimal.
I don't think there's any organic chemistry on it other than the organic
pharmacology, a little bit.
Basically specimens of human beings. That's basically the organic.
We don't really study benzene, except that we know it's a carcinogen and we want to avoid it.
That's about all I know about benzene.
Well, phys ed teachers get a lot of stereotypes and like we're the slackers of the education world.
Well,
because,
Really? I don't know about that.
There used to be a saying.
I don't know about that.
Those who can't do teach. And those who can't teach gym.
Yep.
Have you ever heard that?
Yeah.
It's not true. Totally bogus.
I would love to see. So as a phys ed teacher, okay, I'm licensed in phys ed, right? But I can cover any class. I can cover math. I can cover science. I can cover English.
Well, they usually give the phys ed teachers sex education.
Right. They don't do that, believe it or not, anymore. No.
Laundry.
But what I'm trying to tell you is, so I could cover anyone's
That's
class.
not appropriate.
But in order for my kids to participate in class, another licensed phys ed teacher has to cover them. So, like, let's say a math teacher is covering the class for the day. So the kids have to sit. They can't do anything.
The math teachers can't be trusted to do phys ed, but the phys ed teachers can be trusted to do math.
You have to be licensed, absolutely. So, and we have classes of 50. I teach in New York City. So don't forget, our classes range between 50 and 52. And then we have 2 classes together. So we have anywhere between 80 and 104 kids in our class at one time.
So you teach in New York City?
I do.
So you commute? Or do you,
it's in Queens.
Yeah, I'm in Long Island City. I'm all the way right before the bridge.
And your gym is kind of small. I mean, when I was in high school, our gym was massive.
My gym was massive. There's a lot of massive gyms, but my gym is a very small gym.
Does it have enough room for a basketball court?
No.
Does it have room for a volleyball court?
No, but I make one. I make it.
A miniature.
I do.
My kid's gym, he went to school on the Upper East Side and public school, Eleanor Roosevelt, and it was like there was no gym. It was like a little like a ballet studio.
Dance studio. Yep, I was just going to say that.
It's a problem in the city.
Yeah, it's
a state law
unless
that
you're
you
in
have
private
to have
school and you have a big gym.
You can't graduate without phys ed.
With the obesity epidemic in children, it's really being emphasized. You got to do at least 30 minutes of exercise a day.
Right.
And, it's critical.
It's very important.
And it's also a great outlet for the kids during the day. They love coming in and playing. They really do. It's just a way, and they can sit and talk. You don't have to worry about, unless I'm talking, they can talk to each other. You just be quiet while I'm talking, explaining what we're doing, and then you could talk for the rest of the period and hang out with each other.
So you graduated from
Adelphi.
And you became a certified gym teacher.
Yes.
Which I did not know it's more advanced.
Do you prefer to be called gym teacher or phys ed teacher?
A lot of people get touchy. You could say whatever you want. It doesn't bother me. A lot of people want to be say phys ed. Doesn't affect me.
And phys ed is graded pass fail in the city, or is it graded like ABC?
No, grades.
You get a grade.
Oh yeah, 65 up to 100. 55 up to 100.
It's 2 credits versus 4 credits, right? Is that the way it works?
Well, every semester is a half a credit. So you have to have 4 credits by the time you graduate high school. 3.5, 4 credits, because then the last credit is health. So you need 3.5 of PE, and then the other half is health.
And you don't teach the health education?
I do.
You do?
I do. I don't like to, because I don't like being in a classroom. It's also a reason why I became a phys ed teacher. I don't like to be in a closed environment.
Right. Do they take it seriously when you teach the health class? Do you find the kids pay attention, or the girls paying attention, the guys
my kids pay
snickering?
attention.
Oh, yeah.
My kids pay attention.
You make it interesting.
I try.
Good.
I try.
That's good.
As best as you can.
They have to have some knowledge.
So you started teaching about 20 years ago?
Oh, my gosh, yes.
It's hard to believe.
I remember my first year, I said, you know what, let me get my 1-year experience in the city, and then I'll transfer to Long Island.
That never happened.
That was 21 years ago.
All right, well, you obviously will enjoy it.
I think my 21st or 22nd year. No, I'm going into my 22nd year. Oh, my God.
Has it changed in the last 20 years, teaching?
Yes.
And most teachers you talk to say it's changed for the worse. Do you find,
Unfortunately.
Unfortunately?
Yes.
Is that true?
I mean, it depends. No, it's just different. It's just different.
But it's a good thing, because by working for the city, you get a nice pension. And you put in enough
pension.
And you put in enough time already to get that, I think.
You have, I couldn't retire. I'm too young. And you have to have at least 30 years.
30 years.
30 years.
Really? 30 years?
They changed it.
I thought it was less than that.
It used
No,
to be.
it's more.
When you were a kid, it was like 20 years.
Yeah, it should be that. And I'll explain why. Because you want fresh minds out of college. You know, the fresh way of teaching, the fresh information, the newest information. And now they want teachers teaching longer. Like the new tiers, they have to teach till they're 62.
Wow.
But they're trying to fix that.
All right, interesting.
Yeah.
Really? Mm-hmm. So it's really like 40 years then. If you started 21,
if you started 21, 22, yeah. But think about how nice your pension is.
Wow, that's great.
That's a good.
Well, you
that's the
deserve
only
it
good.
after that much time.
Yeah.
I think so.
Mm-hmm. And then you do a TDA, you put money away, so
Yeah.
you get a pension plus like another 401k.
Sure.
Yeah.
Absolutely.
So then you've been teaching, you've been living your life.
Yes.
And then what happened to you?
And
As
then,
far as like when did you start to get the pain in your back going down your leg?
so the first time I ever had a bad back experience was 2014. I had just moved in to our home. We just bought our home, and we were babysitting, dog sitting my sister's dog, and I literally just bent over to wipe his mouth because he was a big Cane Corso Italian Mastiff. So I didn't want
dogs.
the drool on my floor, so I bent over just to wipe his mouth. And all of a sudden, just something happened in the back, and I couldn't
Did you
stand.
feel a pop in your back?
I didn't feel a pop. I just couldn't stand.
Just had severe pain.
It was horrible.
And did it go down your leg also, or just
I just remember it being right in the coccyx area. You're just sitting, and it was just so painful, and I had to lay down. And I went to a party right after that too, and I was crying. I'm like, I can't sit. This is horrible.
Wow.
I can't stand. I can't sit.
Something happened.
Yeah, so something happened, and then
probably muscular.
Who knows?
To bend forward and.
But you had pain down the leg at that time too, or
No,
I don't recall
just
having
the
it down the leg at that
it
time.
may have
No.
just been purely a muscle pull.
Right. Well, I did. I eventually, I don't remember, I don't think it was that time, eventually went away. And then there was another time I threw my back out, and that was really just as painful. And I think I did an MRI, and they noticed I had a slip disc. So whether I slipped my disc doing that or if I just had it and it's coincidence, I don't know. But I did have a slip disc. And, I guess I noticed in 2015, 16, somewhere around there. And it just, progressed. I would throw my back out every once in a while, and it was just horrible. I'd take, steroids, and then it would help, and move on to the next. And then you hope you don't happen.
I mean, your life is like physical therapy, being a gym teacher. You're constantly stretching.
Right.
Moving.
You have to participate in these activities.
I used to be more active. I used to do a lot of Zumba dances, a lot of Zumba classes in my career.
Are you a Zumba instructor?
No, I'm not a Zumba instructor.
You can make extra money doing that.
You have to do.
It's intense.
You can't imagine how many hours you have to dance straight in a row just to become a Zumba instructor. Wow. I think it's like 100 hours in a row. I mean, it's like a ridiculous.
It's a real
amount.
Exercise.
It's a great exercise, and I love dancing. I've always loved dancing.
And it's good music, so it's kind of fun.
Right. So yes, I did a lot of I would participate with my kids, but you're not supposed to technically get involved in sports because if you get hurt, you're not technically covered. So you do have to take a step back.
I remember the gym teachers used to do the stretches and the calisthenics with us.
Oh yeah,
they
warm up the class.
Warm up the class.
But as years go on, you have to have different things going on in class. So I have my kids stretch out the class now because you want all active.
Yeah, sure.
People getting involved so yeah. And
gym teachers were they would wear sweats to work.
They were like more,
shorts,
relaxed.
I don't wear shorts to work, but I do. I have my leggings, my yoga pants, sweatpants. Nice. Yeah, you're always comfortable.
But I tell you one thing though, I remember one of my gym teachers. He was this big, strong guy, and I forget his name offhand. But he
was your wrestling coach.
No, I wasn't on the wrestling team, but he was a very.
You were a swimmer.
I was a swimmer, but he was a very good gym teacher, and he was very interested in us. And he was when I remember my parents took me away one year on a vacation in September. That's when they like to go. I got permission to go. In those days, you could get away with stuff like that. And he was the only one who asked me. He demanded
paper.
He demanded I keep a journal.
Okay.
And
a good thing.
And then afterward, I did it. And I gave it to him, and he reviewed it, and he loved it. And he was the only one who actually was interested enough to make me do something like that. And I thought that was very cool.
That is very cool.
It's unusual, actually.
I'll never forget that. Yeah.
It was during a vacation, or
it was during a vacation. My parents took me away while I was in school. I got
permission.
So
it was during the school time.
Right. So I had to do my homework.
So
that was your participation grade.
Well,
that was a way of you getting graded.
At least that I came up with. I thought it was a good.
It was a good one.
And I still have the journal,
Do you?
and I look at it every so often, and it's kind of cool.
It is cool. It's kind of what I had my kids do during COVID.
During COVID, right?
It was
It's difficult.
It was a difficult time, especially like phys ed on camera.
Yeah, how do you do that during COVID?
You were doing phys ed remotely?
Yeah. Yeah,
so the kids had to do jumping jacks on our video.
No, you're not allowed to. I don't know how it works on Long Island, but in the city, you cannot make them turn on the camera. So I looked at a blank screen.
Are you kidding me?
That
was an insane time.
They can get away with that. I didn't know that.
There's reasons for it.
What's the reason?
A lot of these kids are in homeless shelters. So, you don't want to see where they are. Who knows where they are actually at that moment. They don't want to show.
But homeless shelters have cameras and have screens that they get able to.
Every kid had a laptop.
So they all have the laptop. But does the laptop come with a microphone and a camera in them?
Usually.
But they just don't want to turn it on just to shield them.
Right.
From embarrassment.
Well, no, we can't force them. I mean, they could. I very rare had kids put on their camera. Like I just said.
It's like calling it in.
You're sitting there in your pajamas, I guess, and
not me. No, I always got dressed. At least from the
waist
up.
But they
you were. It's like having the podcast, not wearing pants.
Yeah.
Well, you could technically get away with it. I've been on some Zoom meetings. Where it wasn't exactly.
That's really fascinating. I didn't know that they could do that.
I didn't know that either. Because my kids went to school in the city, and I don't remember.
Did they do Zoom classes during COVID?
They had Zoom classes during COVID.
They left their cameras on.
I just didn't know I thought they had to have their cameras on. I didn't know that.
You can't make them.
I'll ask them about that. I wanted to know.
At least not my school.
How they handle that.
Most schools have that policy. You can't make a kid turn on their camera. You just can't. And they certainly can't lose points either for not turning on the camera.
There's too many rules.
There's a lot of rules.
It's all for them.
It's all for the kids. It's all about the kids.
It's all about the kids.
So you went over.
But then is that true for other classes as well?
Yes.
It must be.
Yes.
So they're thinking they're in English class or math class, but they're just like watching a cartoon or doing something else, and then we wonder why they got delayed during COVID.
That's exactly it. They were
definitely.
I think that when you don't have the camera on, it's more
right.
It's like a license to do whatever the hell you want.
Pretty much.
But I will tell you, I had a lot of kids for extra credit during the classes. They would video themselves exercising. And then they would send them to me. And that was actually kind of fun.
That's a good project.
Yeah. Or I would stay on, I always stayed on the whole period, which is 15 minutes. So I would stay on for the 15 minutes, and if kids wanted to come in, and after I would dismiss them, I would stay on. If they wanted the extra credit, they would do live. I tried to make it more involved because I wanted to see them too. I'm sitting here and I'm literally talking to myself.
Depressing time.
It was hard. It really was.
Miserable.
I missed the social interaction with my students. I did.
Oh yeah.
But I did love being home too.
The other good thing about being a PE teacher is there's no papers to take home and grade. Right?
Health class.
I remember being in high school, I took tests.
They gave you tests?
In high school, I took tests. I've given tests in my career.
For like a physical education?
What are the
you test them on sports.
What are the rules of the sports? Like the game of soccer,
yes.
how do you...
Yeah. Really? I did that in my earlier career.
I never had that.
That I remember.
Yeah, I did. I had my own tests.
All right. So
you started getting these back problems and occasional spasms,
yes.
and periodically you end up getting diagnosed with a herniated disc.
Yes.
You take periodic steroids or NSAIDs.
Yes.
And did you ever do physical therapy or chiropractic care?
I did it once, and I thought it was a joke.
You were doing your own stretching and working out.
Yeah.
And you weren't getting much in the way. It was more back pain.
It was back pain.
And not so much in that going. And then when did the pain that went down your leg start?
Oh God! So it was this January that just passed, January of
this 2025.
2025. I woke up in the middle of the night and I had this horrible cramp in my right leg. I just had a cramp. I woke up, I had the cramp, I went back to sleep. I get up the next morning to go get ready for work, and I don't feel my right leg. From my butt to my toes, it's completely numb.
It's pretty frightening.
It was. And then I'm thinking, oh, wait a minute, is my leg asleep?
It felt like it was asleep.
Right.
Right. Maybe you slept funny or something.
You thought it would just go away.
You know, like how when as soon as something's to sleep and you wake up, it starts to tingle and and then that wasn't happening.
You shake it off and it gets better.
Right, and you get to regain your sensation.
Right, and that wasn't happening, so I started freaking out. And then I'm standing and I'm like, what? I was in excruciating pain to stand for no longer than 3 minutes.
Oh.
It was hard. I was so scared.
What were you doing? Do you recall doing anything particular before that happened?
And the leg pain was worse than the back pain?
Nope. Oh, the leg pain made my back pain non-existent at that point because that's how horrible it was.
It was mainly leg.
Right.
And it was feeling numb. And were you having weakness at that time too? Like, was it starting to feel a little weak? Like your big toe?
You couldn't put weight on it or something like that?
Well, as soon as like I said, if I stood for 3 minutes, the pain was horrible, so I just sat down. And then at one point, the pain was even worse, that even like sitting down wasn't alleviating the pain. I had to like lay on my side horizontally.
Couldn't get comfortable.
Right.
I find that the patients, when they have back or back and leg pain, it's the leg pain that really disables them. That more even so than
I couldn't go to work. I couldn't go to work.
That's pretty classic for herniated discs. Is that the leg pain is much worse than the back pain. It's funny because sometimes we get people who are injured at work. They have a workman's comp case,
right.
And they come in complaining of leg pain, and we have to get authorization for an MRI. We figure out that it's probably coming from their lower back, and we have to fight with these insurance adjusters that it's actually coming from their lower back. We need to MRI the lumbar spine. So because sometimes people will see other doctors who mean well and they don't really understand where the pain's coming from. They get an MRI of their leg, which is totally normal.
I love that one, actually.
Or the ankle, or whatever.
Or an X-ray of the leg.
Yeah.
Hence my poor husband.
And you're like, well, that's not really the source. That's coming from the back.
I mean, sometimes you have to it can differentiate between hip and back. Sometimes it's good to get X-rays of the hip, but still, if it goes down to the foot, that's usually from the back. That's disc.
And usually hip pain is more in the groin.
Yeah, I didn't have hip pain. I just had horrible
pain going all the way down.
Yes. Yeah.
So what was your first thing you did that day?
The steroid pack, probably.
I think that I
remember you taking some steroids.
But who did you call for?
So my husband is a very good. He unfortunately is a workman's comp case. My husband. And believe it or not, we met you back in 2014. My husband came to you. I don't know if he saw you first or you first. That's how I got Dr. Obedian.
Okay.
Did we want to operate on him?
It's not. Yes, you did, and you wanted to fuse him, and he just couldn't do that at that point. He was only 35 years old, I think, at that point.
Right.
So he didn't want to get fused. And then there was the case of workman's comp. Workman's comp, you have to wait.
It's torture.
2 months just to get the MRI, like you were saying before. So unfortunately, maybe if PJ had gotten his, like how fast I got mine, he would be better to. He suffers every day, all day.
He ended up having an operation in Manhattan.
Yes.
And the doctor didn't do a fusion, or he did do.
He did not do a fusion.
And he's still suffering.
Yes, he had the laminectomy and microdiscectomy.
Yes.
He probably needed the fusion.
That sounds
maybe it's possible.
Sometimes you really do. This. Look, obviously you want to try to avoid doing more than you have to, but sometimes you worry that the problem will just persist, or the patient will have a recurrence. Sometimes you have to every case is different, obviously. Yeah. And people are scared by the idea of fusion. They think it's nuclear fusion. It's not nuclear fusion.
No, they're scared by the idea of rods and screws.
They just can't stand the idea of metal. But they have no problem getting their ankle or their hip or any other metal. But when it comes to the spine, it's mysterious.
Because they think they're going to lose all their motion.
Right.
Yes.
Or they're going to be paralyzed.
They're going to be debilitated. They think, they have these strange thoughts.
Yep, they do have thoughts.
The Google is not always your friend, and people are really terrified of hearing about a fusion.
It's becoming more difficult.
But luckily, I was able to get Obedian's number through PJ, and I called. We went, and I think they got me in the same day. It was great.
Yeah, we got you right away.
Lauren, I spoke to Lauren. Lauren's
our office manager.
And she's fabulous. I don't know what I would have done without Lauren. Yeah. I really don't. And so we got in, and you said to me, we went over everything. You told me what you thought it was. You said, try an
epidural steroid injection.
Yes, try an epidural.
You had already had an MRI.
She had an MRI. You want to talk about her MRI?
Let's talk about the MRI.
Let's go to the...
We have the side view.
This is the SAG... You want to talk about it, Dr. Sonstein?
Well, go ahead, Dr. Obedian. You can. It's you're on the stage here now.
So this is a sagittal MRI, which means we're looking at it from the side.
That's
right.
right.
When I look at it from the side, this is the sacrum. Do you have a pointer?
Well, you can actually... no, actually, that doesn't... So
this is the sacrum. This is L5, this is L4, L3, L2, and L1. And if you look higher up, the discs are all nice and white. They've got a nice space. And as you start going down, the disc starts to lose their color. They become a little darker.
Less water content.
So the water on a T2 weighted image, which is what this is, the water is very bright white. Okay? So the discs are usually 90% water. So they should be very white. And you just have to lose a small amount of the water content of that disc for an injury to the disc, and it starts to turn a little darker, a little blacker. And then over time, that disc can degenerate and it can collapse, like it did over here at L4 or 5, where there's a small herniated disc. And then there's a really big herniation at L5S1 that you can really see over here. That's a massive
I think there's a big difference between those two discs. I mean, I think that the 4.5 is there and it's collapsed, and it's probably there's very little motion.
I don't think that was the
at that level.
The main pain generator, because she probably had that for a while. There's a degeneration there. She's had history of back
chronic,
problems.
And you see the changes in the bone above and below. The white changes, they're called modic changes. Those things develop with chronic disc degeneration and instability.
That's right.
And right now you're at the end stage of that disc. That there's very little disc left. So all that stress is now being put on the next segment.
Correct.
And that's probably why you kicked out that.
So this
fragment.
is the sacrum. This is L5. This is the L5S1 disc. This is the L4-5 disc. But the 5-1 disc is really much bigger and probably the more problematic one. And this is an axial cut, which is a cut through the center.
You're laying down, your legs are coming out.
So if you cut me in half, this is what I'd look like.
And your belly is up there, and the skin of your back is below.
The skin of the back below. This is your belly, is your abdomen. This is where the disc normally sits, and this is your spinal canal. This is the lamina.
Oh, God.
That's the spinous process, and these are the paravertebral muscles. Mm-hmm. Okay? And this is just the skin and the soft tissue. So this bulbous matter, that's the herniated disc.
Right.
So what happens when you have a herniated disc is that the disc consists of two kinds of fibers. There's an annulus, which is a thickening, a thick ligament type tissue, a thick collagen, and that can get a crack in it. Like when you hurt your back, when you go to lift something heavy, sometimes there's damage to the disc. Some people actually feel a pop or a tearing sensation,
right.
And they get sharp back pain. And then sometimes a few days later, they start to notice their leg is killing them. And what happens is that this nucleus, which is the center of the disc, it's like the jelly donut, that leaks out through those cracks, and it's called a herniated nucleus pulposus, or a herniated disc. And that is pressing directly on the nerve that goes down your leg.
Okay.
Okay? So
I felt it.
yeah, you'll feel it.
I felt it.
You'll feel it. And if it's a massive, I mean, this is a very large disc herniation, but if it's more central, it can affect both sides. And if it's really, really big, you can get something called Cauda-Equina syndrome, which thank God you didn't get.
Yeah.
That's a surgical emergency and has to go to the OR immediately. Okay. So what we decided to do was, she's young, It's not proper to ask a woman her age, but let's just say she's 21 plus and under 60.
We try to try to design an operation that does the job but doesn't do more than you have to do to get the job done. And I tell you one thing also, people don't understand. I'm not saying you don't understand, but in general, people don't realize that the spinal cord is not there. It ends at the L1 level, which is upper part of the lumbar spine.
Right. This cut is actually
we don't have a good cut of the spinal cord.
This is on the right side, which is showing the disc better because your disc herniation is more on the right.
This is just a sac of nerves being compressed.
But this is 5, 4, 3, 2, 1. So the spinal cord generally ends around this level.
Oh, wow.
And the disc itself shouldn't be there. So what happens is when the disc herniates, it sets up a big inflammatory reaction. That's why people sometimes respond to steroid injections into the spine, called epidurals.
Oh, okay. I didn't know that. That's I'm learning that now. Okay.
We're always learning.
We are.
We're teachers too. We like to teach.
She's going to
learn something every day
to her students in the gym class.
Yeah.
You know the word doctor literally means translated to teach. So it's actually that's what we always are trying to do and educate. So the white stuff there is fluid, and it's just a sac of nerves in fluid, and your sac over here is being, as you see, is being distorted and displaced.
Right.
The left
this
side
is the sac.
Is better.
It should all be white here.
Oh my God!
Right,
your whole right side is completely blocked.
And in the operating room, it looks like I said, a lump of crab meat. That's how I sort of look at it.
Oh my! Okay.
Well, we didn't rush her to the operating room. We were very conservative with her.
So what did we do?
Okay.
So
we sent her for an epidural steroid injection.
I went on a Thursday. I'll never forget. I went on a Thursday to go get the epidural, and I just so happened to call Obedian's office, and because I don't even know what it was, but I did. I called. I said, "Can I come?" I got in on Monday. I get there on Monday. And he said, he asked me, how's the epidural going? I said, well, they said it could take anywhere from, the day of the shot up to 2 weeks. He goes, it's not working. I said, I knew it. I said, because they told me it could take up to 14 days. And it was Thursday, Friday, Saturday, Sunday, Monday, 5 days. And I hadn't felt any relief.
No change at all. Not even 1 day of relief.
Yeah, you should have relief quicker than 5. By 5 days, you should have relief.
Because the thing is about the people with epidurals, your situation is probably the best chance for an improvement with an epidural, with an acute kind of what we call radiculopathy or pain down the leg, you know. So it's actually that speaks to the size and the gravity of the herniation.
Because the pain of the herniated disc comes from the mechanical compression, but also your body's response to it. Your body knows there shouldn't be this disc where it doesn't belong, and your body attacks that disc, and it creates even more inflammation. It tries to dissolve that disc, since enzyme, and that creates even more pain. So that's why the shot helps. It reduces the inflammation that your body's naturally trying to respond to that disc. Because people have been getting herniated discs since the days we were changing. We were running away from lions, and they would fall and they would get a herniated disc, and over time they would get better.
Right.
But now with the technology, we can see exactly where that disc herniation is. And we really tried our best to get her better. And then she came back to see me again after the epidural.
They didn't do a second epidural.
No.
Just one.
And actually, when she came to see me the second time, she was dramatically worse.
I was just going to say that.
How was she neurologically?
She was starting to develop a foot drop.
Oh, really?
In addition to weakness of plantar flexion, she lost her Achilles tendon reflex. She was extremely weak and could barely stand and walk.
Well,
and so given that, and the look on her face, and her, when you mention the possibility of surgery, people get very anxious.
Of course.
You
should have seen me at the epidural.
I said to her, listen, this is like one of the few times that we tell people you should probably go to the emergency room and get this done as quickly as possible before it turns into a caudate equinus syndrome.
Or a foot drop complete.
And she's young, she's a gym teacher. You don't want this to become, she had significant neurological deterioration.
You don't want your gym teacher to be basically walking with a limp.
The gimp.
Not even. I just wouldn't want.
Plus the pain.
It was horrible. And you said that people deal with that for years. I said there's no way somebody could deal with what I'm dealing with for years. There's just no way. I don't know how anybody could deal with it longer than the 13, 14 days I dealt with it.
That's
impossible.
A long time of being, in that kind of pain.
And I feel like I have a high threshold of pain. And if you're telling me somebody's dealing that with I guess, like I said, my husband has the pain all the time, but it's not like how I felt. I can't imagine.
Nerve pain is one of the worst pains you can get.
You needed surgery. You needed to have that thing extracted.
So the suggestion was go to the ER. So I said, can I call my mom and my dad first? I swear, that's the first thing I said. Can I call my mom and my dad?
That's who really is your biggest advocate.
My husband's in there with me. I said, I called my parents. And my mother's like, Tara, you have to do this. I mean, you can't live like this.
Yeah.
And
it's a stressful thing.
Yeah. And I was going to go home first to get some stuff. I didn't. I just went straight to the hospital.
You were so nervous. You didn't want to.
Yeah.
Yeah, it's probably the right thing to do.
Yeah, and I cried.
Did you have kids at the time?
No, I don't have kids, no. So luckily I didn't have to worry about, dealing with that.
Her kid is her husband.
All right, well, that's probably plenty of...
who, by the way, we invited on today, but he was a little shy.
All right, yes. Look, some people, don't...
He's a nice guy.
He is. He's the best guy.
He's a really good guy.
There's nobody I could spend my life with except him.
Wow.
He's excellent.
I don't know how many people
say that
these days.
I'm very lucky. I'm very lucky.
She found her soulmate.
I did. True soulmate.
That's terrific.
Yeah. And he took care of me didn't leave my side.
Right, so we did the operation at NYU Winthrop.
Wait, I will tell you this. So, like I said, I cried from the time I left his office till I got to the hospital. I relieved a little bit in the ER, but the next morning I'm hysterical crying. He comes over to me all smiley, like with his beautiful smile and teeth like he is, right? And he comes over, how you doing? And I'm hysterical. I said, did you get a good night's sleep last night? I think that was the first thing.
Patients always ask that question.
Is it really?
And rightfully so.
Okay.
You don't want an angry surgeon.
I think it was like 6:30 in the morning. I don't know. I don't remember what time it was. I did.
Well, it was good because it was morning time, and we tend to like to operate in the morning.
Yes. And I thought it was just him operating on me. And then later I found out there was the
whole team.
There was a whole crew.
There was me. That's basically, yes. We do pretty much every surgery together, and you need two hands in there.
Yeah.
Yeah,
but it's just
it's really the best it's the best having both a spine-trained orthopedic surgeon and a spine-trained neurosurgeon. You really have the best of both worlds.
But I find it a little like fate in the sense of, like I said, my husband saw both of you before.
Over 10 years ago.
Right. And had he worked with you guys, maybe and if it wasn't a workman's comp case, it would have been, his life would be better. And then here I am, a little over 10 years later, I get both of you. He saw you guys separately, and now I get both of you, and I'm...
Two for the price of one.
I just don't know. But
sometimes things are just meant to be.
Yeah.
Yeah.
Hence why...
I believe that.
Yeah.
I believe that.
So we do everything, just the two of us. We don't really trained residents or PAs. We do it all together.
Yeah.
Sometimes we get residents in our room,
But
and
they observe, but they're really not operating with us.
we generally don't.
We don't give them an instrument really to operate. We do everything ourselves because our patients, I think, expect that for us to do the stuff ourselves
Right.
on them.
Yeah, well,
which is fine.
it's probably safer that way on the spine.
So we thought about what to do in your situation. You had 2 herniated discs. The question is, what do you do about that? So.
And the interesting thing is that 4 or 5 collapsed disc. It's not that big.
It's
but
more of a calcified kind of
causing some
protuberance.
pressure on that right nerve as well.
So we felt that we should, while we're there, not only get rid of the disc, decompress the nerve that it's compressing, but also decompress the nerve above to get rid of that compression as well.
And she had some weakness of her big toe and ankle dorsiflexion as well. So I think there was a combination.
We decompressed the L5 and the S1 nerve roots in taking out, and we did a laminectomy.
Yes.
To do that.
We did a fusion. We did a fusion a little bit differently. We did what's called an in situ fusion.
Yes.
Right.
So we avoided the metal and the.
I think it's a
hardware.
good compromise for patients because we have, good material to make a fusion. This is what they had before screws and stuff. They didn't use screws all the time.
Right.
They used bone graft material and proper technique to expose the bone you're going to connect and create the environment you need to do, and then you lay down bone material on the sides. I call it bone dust for patients.
Okay.
I think it makes them feel a little bit more comfortable when they know we're putting fairy dust or bone dust on their spine. And I say this is the fun part of the procedure. It's
Yeah.
This is
He
where
never uses the word fusion.
This
he
is
just says
where
we're
we're
going to
listening-
sprinkle some bone dust, like it's a magical
Okay.
substance.
You know what? That's sort of what we're doing in a more
It's true.
simple term, but nevertheless, you have to do it right, and the bone has to be clean and drilled properly on the sides. But the main art of the surgery is to get rid of that fragment and separate it from the nerve and do it safely.
And make sure the nerves are free.
And make sure those nerves, when you leave there, those nerves taking off into the little canals are free.
Okay. Well, you did it.
And we did that.
So when you woke up in the recovery room, did you feel immediate relief of your leg
Yes.
pain?
Yes.
You knew right away.
Immediate.
Oh, that's satisfying.
Oh my God.
It's like life
And
changing.
it's like you said it too. You said you're going to feel it immediately. You told me that, and I did. It was
He's so
amazing.
confident.
And I mean, he is.
Well,
he
he's a
really
little-
does have confidence, though.
I know,
But
he's
he
very
makes
confident.
me feel it,
Do you
though.
want a surgeon who's like fearful, doesn't have confidence?
No, but
That's not a good look.
No, it's good. But
And not for nothing, the confidence is based on seeing her problem
and knowing from experience,
and her exam and her symptoms.
it all
are being
correlated.
caused by that.
Well, that's
And
the
so
best
you have-
setup
you-
for
you-
success.
And so you've got a reasonable suspicion that if I get rid of that problem, she's going to get better.
Yeah.
It isn't like somebody who has some vague back pain and has an MRI that shows some mild degeneration. That patient, I don't have such confidence. I'm not going to recommend an operation to that one
Right.
as quickly.
Yeah.
But this one, I think, this is almost like a home run kind of thing.
This is one of our favorite operations to
You
do.
did say that, too.
because
said that?
because of the rapid relief.
Because he said he knew. He said that he knew
happiest
how
patients.
how good I was going to feel afterwards. That's
I mean,
why he
sometimes,
said it.
obviously, with the nerves been battered for so long, they don't always get immediate relief. Because the nerve is still damaged and has to heal.
Right.
But if it's been a relatively acute problem, then the chances are you are going to get relief, from getting rid of that chunk of crap.
What I always say is your pain will get better rapidly, but I say, but the numbness and the weakness, that could take some time.
Yes.
It doesn't
You
always
did.
get better as quickly
No.
as the pain.
The pain gets way first.
goes way first.
Right.
And your numbness and weakness, but that did improve.
It has improved, and I feel like it's just just keeps improving.
So you still have some numbness and
I
tingling?
do.
Yeah.
I have it. If I touch the back of my leg, I feel that numbness feel a little.
Feels a
Not
little
as-
different.
Right. It feels different. My heel is still numb, and the right side of my foot, to my right toe,
S1 nerve.
and the second toe over. Yeah.
Yeah.
I still have
And the
numbness.
surgery's done what was the date of the surgery?
February 10th.
So February 10th. So it's been, March, April, May.
It's been about 6
months.
months.
Yep.
Just over 6 months.
So 6 months. So I would say give it we have to tell patients give it a year to even 2 years to see how the extent of the recovery of the nerve will be actually.
Right.
Right. The peripheral nerves regenerate. Your central nervous system, your brain, and your spinal cord, once that's gone, it's gone. But the peripheral nerves, they grow back about 1 millimeter a day. So
Millimeter a day.
My last follow-up visit, I said to him, because right before I came to the office, I went to the bank, and I was standing in the bank, and it was a long line. So I went to like stand up on my toes, because that's like one of my tests I do with my right leg to see if I'm gaining strength in it.
That's a very good test.
That's a good test. That's a good test of the S1 nerve root. That's plantar flexion.
Were you able to do that?
And I was able to stay up for like, a lot better on my right leg without the help of my left leg. But he's like, "You're just standing up on your toes in the middle of the bank?" I said, "Yeah."
Why we? That's great.
I mean, when you can't do that, we take a lot of things for granted.
Yeah,
standing on your toes is a you need to do that sometimes.
I couldn't. Like, I can go up on my left side, no problem. And obviously, before the surgery, before my problem, I went up on my right. So left is fine. And every day I test myself on my right leg to see it getting better, that I'm able to go up on my right foot.
How long were you in the hospital for afterward?
So we did the surgery Monday. I left Friday afternoon.
Okay.
Yeah.
You need some time sometimes after such a thing because, you need to be able to...
Or was it Friday to Monday?
Monday to Friday.
Monday
yes.
to Friday. You have a drains in, and sometimes the output is a little more, so we want to make sure you're safe. So we keep you in the hospital.
Yeah.
You get physical therapy, make sure your bowels are working, you're eating, eliminating. All those things are important to do. So we never kick anybody out of the hospital.
No. Everybody was very nice.
That's great.
Well, because when the plantar flexion, when you're standing on your tippy toes, that's a muscle you use all the time when you're walking.
Yes.
You use that even when you're driving. You got to push the gas pedal. That's the gas pedal move.
You definitely need that strength there.
And especially in your right leg. That's your driving leg.
Yes.
So it's really critical that you got to get
I'm telling you, I test it all the time in the middle of the bank, standing online at the supermarket, whatever.
Just keep practicing.
When you went home, what did you do when you went home? Like, how did you, handle things?
Very slowly. I was so nervous being home, and
you took time off from work.
I did. I was home for
That's
3
the
months.
advantage of being a school teacher.
Yeah.
How long did you take off from
3
work?
months.
3 months.
I didn't go back till May 1st.
Okay.
Yeah, April 30th, May 1st. But everything was just slow, I mean, normally the first thing I would do when I get home from a hospital is shower, and I don't think I did right away because I couldn't. One, I had to wait to run water down the back. And I sat on the couch. I put a sheet on the couch, and I just sat there. I slept on a recliner, I want to say, for a good 2 months. It took me a long time.
A lot of people like to do that, yeah.
Yeah, and
it's a pretty common
but
thing.
PJ was like so sad and missing me in the bed. He was sleeping with me on the couch, and it's uncomfortable, to sleep on.
How big is your couch?
Oh, I have a huge,
massive couch.
I do. I have a nice big
That's
couch.
very real of him to come down and join you there.
That's why he's the soulmate.
Well,
yes.
He's used to her presence.
He is a good guy.
He's a good guy.
I mean, I get up. Getting up to go to the bathroom was horrible. It was so horrible. It was painful. Just everything.
You're having back pain.
I was having back pain.
Swing your legs.
Yes, I'm sorry. Let me clarify. It was the back pain.
From the incision.
Right.
It's more incisional pain.
Yes. Yeah. It wasn't pain in the leg that I had. It was just, and the soreness of everything.
Most people
my
can
back
deal
was
with
swollen.
that. The incisional pain is a relief, in essence, from the leg pain.
It's different.
It is different. It's a good word to say. Different.
It's different.
And I get up a lot to go to the bathroom because I'm constantly drinking. So, an hour goes by, I have to go, and I feel so bad waking him up every time. I needed that wand. They call it the pee wand.
What's the pee wand?
It's the pee wand that I used in the hospital. You don't have to get up. You just it's not like a bedpan or anything.
You mean catheterize yourself?
It's not. It's not a catheter. It's literally like this wand that you put there. You pee and it just sucks it up and puts it in a.
Really?
Why am I not
a
familiar with
container.
You
It's
don't
fabulous.
make rounds anymore. You don't know anything.
Oh my
that's going on
god,
in
it was
hospitals.
great. I should have brought it home with me.
I don't know. I didn't even know that existed.
It's just because
That's
I
not
go, like I
true.
said,
I make rounds.
I constantly drink, so I constantly, have to go to the bathroom.
pee wand.
I call it the pee wand.
They sell that on Amazon?
Yes, and I should have bought it, but I didn't
much
because
are they?
you have to get up and move. So if I had
is
that, I might never get
fascinating.
up.
What's also hard for patients after spine surgery is getting down on the toilet. So we oftentimes
need a
will
raised
prescribe
toilet
a
seat.
raised toilet seat is very good for patients
So
sometimes.
PJ went and bought me one of those a seat heightener.
Yeah.
So it's just almost like I just leaned back and sat down.
That's
Right,
makes it
because
a
it's
little
really
easier.
hard to go down
Yes.
that distance,
Yes, and
and getting up.
Were
My
you taking
bullshit.
a lot of painkillers after the surgery?
I did.
Oxy
I took my
yeah.
I took my painkillers. I took the muscle
That can
relaxer.
constipate you also and make it hard to go to the bathroom too.
Right, but I took stool softener like a Colas or
Colace.
right, whatever. Mm-hmm.
Yeah.
I mean, you don't realize these, doing the surgery was one thing, but, it's all these other things you have to consider after the surgery.
Did they set you up with home physical therapy?
So eventually, did they do home?
Did they send a physical?
Did somebody come home?
No.
Nobody came to you.
to help
You were doing too good.
Yeah.
Plus, you're a gym teacher. They
and I did walk. I mean, I think you made me walk the second day. I didn't walk that day. No, I walked Tuesday. Yeah.
But you walked far enough where they didn't really think you needed much more.
Right. I mean, they couldn't believe how well I did just from that first walk. Yeah. And then I did the steps, a couple of times. I couldn't believe I was walking. I was like, holy crap, this is crazy.
When did you start outpatient physical therapy? Did you have outpatient physical therapy?
No.
No, I didn't have Well, I went to therapy.
You went to therapy after the surgery?
Yeah.
I sent you for therapy
I did.
a month later.
Yes.
Yeah,
I think it was
basically
a little
month,
longer than a month.
Because you need some time to heal that wound before you really can participate in physical therapy.
Well, after you've had a discectomy like that, we don't remove the entire disc.
Right.
You just remove the part that's pressing.
That's herniated.
Yeah.
So one of the risks of the operation is that if you overexert yourself,
you could re-herniate.
You can get a new herniation at the same level.
Right. So you want that to sort of scar in where that area was,
So you tell people not to do any kind of heavy lifting, no bending, no twisting for the first 4 to 6 weeks. Really just walking is the main thing we want you to do.
That's what we did.
And then after that, then we start you on outpatient physical therapy about 4 to 6 weeks after the operation.
And that's what we did. That's exactly what we did. It was like 6 weeks.
Are you still getting any therapy, or are you pretty much done with it?
I'm a dropout. Physical therapy dropout.
She's like a school dropout. She's a physical therapy dropout.
You just wasn't achieving any more, improvemements.
No, the best part about it was the 5-minute back massage I got at the end.
Yeah, your husband could do that.
Yeah, exactly.
So here you are now. You got back to business.
I did. It was hard. I went back to work. I had April and May, and then luckily I was off. You had
a nice summer to even further recover from the whole experience. Yep. That's great.
I go in the pool every day.
Swimming is probably the best exercise. Yeah, swimming we let people do right away.
Swimming is great.
Yeah, it is.
Yeah. You have access to a pool. It's really good exercise.
Right,
it's
out the backyard.
Yeah,
because you're also it puts less pressure on your joints, on your back.
Yes.
It's also cool, especially in summer in Long Island can be pretty hot and humid, so it's nice to go. It's refreshing.
It's hot out there right today.
Today is
I might go in as soon as I leave here.
It might be a good day you go back to the pool. You have your own pool?
I do.
Oh, that's great.
Yes.
Yeah. That's really helpful. Yeah, it's great exercise.
Dr. Sonstein still swims.
I love my pool.
I think.
I was a good
How many
swimmer.
laps you swim today? 100 laps this morning?
Yep.
Oh wow, that's great.
I must.
We call him the dolphin.
Where do you swim?
In my pool.
Oh, you do it in your own? Yeah.
Yeah.
Oh,
I got
nice.
a 40-foot, pool, and it's pretty much about 15 to 17, basically strokes across it, which is good. And it's just the best exercise. You feel so good afterward.
Yeah.
And I love doing it right before a case because then I feel really just motivated. Oh yeah, I come in. I'm like, yeah, I want to do my surgery.
Right.
And I love that.
Right. Well, her concern was, did you have a good night's sleep?
Yes.
Well,
you have a good night's
very
sleep?
important, and I think that by doing the
exercise,
swimming makes you sleep better.
It's worth a couple hours of sleep.
Yeah.
Absolutely.
It's really good.
Yeah. Yeah. So I mean. Oh, so I do like telling people the story how the first time, like my husband saw me back, he saw like all these markings on my butt. Like all these signatures. I said, everybody signed right below the.
Well, you don't want to go in for
law in New York.
And
you have to do a timeout before the procedure.
Yes.
So we have to sign our initials
where you're operating.
So I like telling people that. I said, you have all these signatures on my backside after the surgery. They go, why? I said, it's a law. They have to do that now. And people are like, really? That's so. I'm like, I'm teaching them. I'm telling them.
There were some cases of wrong site surgery.
I've heard
where they operate on the wrong leg, the wrong knee. The back, it's not. You're not going to operate the wrong.
Right.
I mean, it mattered in your case because you had your disc was more on the right side.
Right.
But
you got to make sure you're at the right level. That's
right.
Just be thankful you're not a urologist. We have to. I don't know what they do. Do they sign?
I'm sure they sign where their body part they're working on.
Okay.
They have to do that.
Don't ask, don't tell. I don't know about that.
Yeah. But
that's great. Well, so we have a very good story.
I have a successful story, thank goodness.
And they treated you nicely in the hospital and everything.
They did.
That's
yes,
great.
They were very kind.
I think the physical therapy team at NYU Long Island
they're
a very good team there.
Yeah,
and we have PAs there that are really good.
It was great.
Yeah, they're really excellent. Very, very professional.
Great team.
They try to get people up the first day.
Yeah.
Right.
They're very motivated.
That's very important. Really,
they're not
get
fearful.
yourself up.
I've been to other hospitals where the physical therapists are terrified.
And they come twice too. If they notice that the patient is not really ready to do it at that time, they come back. Sure. They don't just leave them there till the next day.
Right.
It's
very good.
And I remember my back, I still have the slightest little swelling on my back, just the slightest. But I was so concerned for so long that it wasn't going down, and Dr. Obedian assured me it was totally normal.
And it's normal now. It's
yes.
flat, and
yes.
you're happy with your wound and everything like that.
Oh yeah, it was a beautiful job. It was very nice. Yes, I knew there was a plastic surgeon
who does a beautiful job.
He
closing.
did.
That's great.
He did.
Yeah, as far as the swelling goes, so often we have patients who have had a back operation and they go for an MRI afterward for whatever reason, and they still see some swelling in the back, like a year or two later.
Or fluid.
Oh wow.
Fluid collection.
Yeah.
And some doctors get so concerned because the radiologist always writes in the report, cannot rule out infection or
or spinal fluid leak or something like that.
Right.
That's the thing we always fear.
No, you don't have. It's just normal. Leave it alone.
Right.
Well, you create dead space, so not all the time do people anneal, so properly, and they still have
body
some
forms some fluid in there.
fluid, and it can be chronic. The fluid can be there for years. I've had patients,
but it's not
for years.
A problem.
No.
That was another thing about going home, like from the hospital. I was like so nervous, like ripping my back open. I'm like trying to stay straight, because they said don't bend, don't twist, don't. So
I
I'm
feel like you just have to stay in
like
one
I'm
position,
like right,
like a robot.
Right, exactly right.
Usually things are closed pretty well. They close.
They do.
You close very deep to the superficial, and everything is really quite closed from the plastic surgeon, who does a really great job on patients. So we have that to offer patients, that aspect.
And then you've been able to get your life back. You've been able to travel a little bit this summer.
I did.
You went to the
I
Jersey
walked
Shore?
the boardwalk on the shore, and there's
Like a Long Beach area? Or?
Wildwood.
Oh, Wildwood.
Wildwood.
I used to go there when I was a kid.
My whole family lived. My mother's side of the family lives down there.
I used to go to Brigantine, and we used to go down to Wildwood sometimes, but we usually stayed around.
Still
Brigantine.
a happening place, Wildwood.
Yeah,
It
Wildwood's
is.
wild.
It is.
It is a very nice.
You know what? Wildwood. You wouldn't even believe how. I mean,
Wildwood
everybody
Crest.
from Philly goes there. That's like a big Philly thing.
That's
where I grew up. So that's where
Are
I
you
went
serious?
Yeah.
Oh my gosh.
I went to the Jersey Shore. I was where I hung out. My whole family, for many, many, many years.
That's so funny.
Are you from Philadelphia too?
I
No,
am
you grew up
not.
in-
I don't.
Long
I
Island.
have a stereotype against Philly people. I'm kidding.
Well,
Philly and Staten Island.
There's Philly.
Philly and Staten Island.
There's the North Jersey type, and then there's more of the South
I grew up in
Jersey
North
type.
Jersey.
Yes, I know the type, like the Asbury Park.
It's like two different states, Northern and Southern Jersey.
It's totally different.
But a lot of Canadians go to Wildwood. Out of everywhere to go in the world with a
Really?
beach, Wildwood is like
they don't have any,
the new Canada.
in Canada,
Yeah,
and
but
it's cold.
But there's so many other places to go to, even further north, and go down to Wildwood.
Jersey Shore is pretty nice.
It is nice.
There's a feel to
When
the
was the last
Jersey
time
Shore.
you were on the boardwalk, though?
I haven't been to the boardwalk in
Yeah,
forever.
I don't know if you
Because
feel that way if you went on the boardwalk now.
Yeah.
I mean, I would love to go back there, though. I miss those summers.
Why don't you take your kids next week?
My kids don't want to do
Your daughter
any-
goes to Rutgers. New Jersey
my
school.
kids don't want to do anything with me anymore. That's like to get them to just go into the car is impossible.
The
go
problem
up.
with kids is that once they're cool enough to hang out with, they want nothing to do with you.
Oh, that's so sad.
It is really sad to me
sad.
because I feel like God, you should
I'll
experience
go
this
with
and
you.
that.
I'll
I know
go.
he's always willing to do.
See,
stuff.
I don't have kids, but my sister has 2 boys, and they're mine.
Right.
So
You're the favorite aunt.
I am, and for a long time they would call me mommy number 2, and then they started doing it at school, and they had to stop because they thought, oh, mommy number 1, mommy number 2, so they had to stop calling me mommy number 2. But the oldest one is 12, and I'm so afraid of that time happening because it's still, he wants me around all the time, and wants all of us together. So, but now he's starting to do the whole
the teenage
going on the
years,
bike ride with the
yeah.
friends, and
a little
so
right.
sad.
But
I know
they'll-
it's coming.
They'll come
Yeah.
back.
I know they will.
They'll come back.
I know they will.
It's just normal rite of passage.
I mean,
I don't know. I'm
I
still waiting
remember
for
being a
that.
teenager and my mother always around, because she was fun.
right.
And everybody wanted to be around her.
And being the aunt, you're kind of the fun aunt.
Exactly.
You don't have to be the disciplinarian.
You don't have to
Right,
have all that,
right.
responsibility as much.
You can hang out with the fun aunt.
Right.
I had a
She'll take us on the
my
rides.
dad's sister
at the-
was my fun aunt. I had a good time with her.
Yeah. And we live around the block from each other, so it was perfect.
That's very nice.
yeah.
You guys
They
do-
ride the bikes now over to go in the pool, the boys.
You can look
That's
out
good,
for
yeah,
each
'cause
other.
that's really good.
Yeah.
Wildwood. Boy, that's a great.
That just brought you back, huh?
Yeah, I used to love just the whole feeling out there and the food and
The cheesesteaks.
Yeah, and the stromboli. I remember the stromboli.
Stromboli, I know.
That was my favorite thing.
Corn dogs.
I wasn't a corn dog. No, it was a stromboli
terrible for
and
you.
pizza.
But see,
Italian.
like in Wildwood, like when I was a kid, I said, "Oh, can I please have a Philly cheesesteak?" Right? And everybody started laughing at me. And I said, Michael, to my cousin, I said, Michael, I said, why are they laughing at me? He goes, Tara, down here, they don't say Philly cheesesteak. You just say cheesesteak, right?
Right, because they have their own version.
Right, exactly.
Yeah, well,
but
it's
cheesesteaks
the
down
Philly
there.
cheesesteak. It's just
right. A Philly cheesesteak in New York is not like a cheesesteak from Wildwood or I'm sure Philly. It's totally different.
It's totally different.
It's totally different.
It's
so
better?
much better.
It's better.
A real
More cheese?
cheesesteak, yeah. You
the
go to
way-
Miller's or like Texas Roadhouse to get Texas a
a
Philly
cheap
cheesesteak. It's
imitation.
not a real Philly cheesesteak.
You need Cheese Whiz.
Cheese whiz? Oh, is that what it is? Is that the secret ingredient?
Jim Steaks in Philadelphia used to have that, and Pat Steaks.
Is that even real cheese?
Yeah, well,
I don't think the cheese whiz is real cheese.
You can do
it's like cheese food
each.
or something.
You can ask for real cheese, or you could just have the cheese whiz.
Did you just say Pat's? Isn't that in Manhattan? Pat's cheese.
No, there's in Philadelphia.
Oh, it's-
There's Geno's.
Yes, Geno's is the big cheesesteak place. I know that. I've never been to Philly.
You never been to Philadelphia?
No. I think I went once
She got disgusted by the Philadelphia people in Wildwood.
Philadelphia is a little different than it used to be, unfortunately. Things have
Everything's
changed.
different than it used to be.
It's a little rougher neighborhood,
Unfortunately.
Philly.
But I wouldn't mind going back to the
Philly.
Jersey Shore. You know, it's nice.
My cousin lived in Philly. She just moved back about a year and a half ago. And I want to say it's because every day there was different damage to her car or bullet hole in the car.
Oh, God.
Well, you went to medical school in Philly.
I went to, it was a rough neighborhood in Temple, North Philadelphia. That's a rough neighborhood, yeah.
Where I first started teaching was a rough neighborhood. I started teaching at Franklin Kaleen in East New York.
Oh, East New York. That's a known rough
One
area.
side of the school was Queens, one side of the school was Brooklyn. So it had a Brooklyn address, but it was really in Queens.
Oh, really?
Yeah. But I was 23. I just
And
started
you were
teaching.
teaching gym there?
I was. That's why my first spot.
Wow,
Crazy
that must
for-
have been kind of interesting.
It was. It was. I mean, I was 22. I think I just turned 23. My students were 21.
They have metal detectors in the school.
They did have metal
That's a little
detectors in the
scary.
school. Oh, yeah. I mean, here I am.
And they threaten people.
I got
the
punched my
students.
first
You
year of
punched.
teaching.
Ah,
My first
that's
year, I got
crazy.
I
punched.
can't
Yeah.
imagine that.
Yeah, we went to
my
court
God.
and everything.
Wow.
She got expelled. Yeah.
That's a big
Man.
deal.
Oh, yeah.
Do you think a kid would get expelled now for punching a teacher?
I think that
2025? It's
That would-
it's a sin, but
I don't
I
know.
wonder because I see these
I do
teachers
think that a
sometimes.
kid.
they would have
I
to
do.
be disciplined.
They
There's
would
no
be.
way they could get away with that
well,
sort of thing.
They say the kid has some kind of autism disorder or they're on a spectrum or something. They get out of it.
I could tell you stories, but that would probably be for a different
another
kind of.
podcast.
Yeah, that's another podcast.
That's
I have
another
good
podcast
stories.
Well, I mean, I'm so
I'd
happy.
like to
that-
digress about these things.
I know.
It makes the podcast fun for us.
Yeah, I know. I mean, you realize that these patients that you operate on are actually real people with
have
real
a life.
stories, and they have a life.
Yeah, and they get back to their lives. That's the beauty.
Yeah.
That's the fun of this.
That is the nice thing about the whole thing of what we do is seeing
You do-
patients that
yeah.
we
It
operate
gives
on
That's
us.
back
nice.
to
Yeah, I
life.
really like my patients, and it gives me good job satisfaction to follow you afterwards. I get that benefit to see you as you progress. From the day we met you to
Yeah.
the day we sent you to the emergency room to the tears, and then the happiness.
Lots of tears. I
and
got my
the pain, the
5-year-old.
struggles, and the just
Yeah.
reassuring you, knowing that it's going to be a good outcome. And we're so glad you came today. We're so
Yeah.
glad you had a good result.
Thank you.
So pleased.
We are, we're thrilled that you came. It was a big deal to get you to come.
It's not an easy thing to go and talk about your story,
No,
but
but I'm happy I came. And
We really admire you.
We
Thank you.
appreciate it.
and,
too.
and I thank you guys for giving me really a life back because there's no way you could live life like that. There's just no way.
It makes our job, basically what we signed up for. You know.
Yeah.
Good job, good good satisfaction.
Yeah.
Terrific.
Thank you. So
we
thank
helped
you.
you.
All right.
Thank you.
Absolutely.